This is an alternate treatment for chronic cases of symphysis pubic hypermobility, and this was motivated by a patient who is ambulatory and had a blunt trauma to her pubic joint, and it healed to some degree, and when she delivered twins there was a repeat injury to the pubic joint, but she is ambulatory. And use this only under the direction of your healthcare provider. This is not a treatment for acute cases. Acute cases require diagnosis, and the most appropriate treatment in the literature for separation of less than 25 millimeters is a pelvic binder worn low at the level of the pubic joints. But again, this is for a chronic case that still has some symptoms but is functional. Now, she does not tolerate an SI belt worn high. She does not tolerate a pubic support worn low for a variety of reasons. And so this is an alternative to applying compressive forces to the pubic joint. And what you can do is lay on the side and isolate the trochanter and bend the hip up 90 degrees and cross the leg over to the right so that you bring the trochanter a little bit out of the way, and you place a piece of foam. This is a 2" by 4" by 8" foam, and you place it on the anterior margin of the pelvis, but again behind the trochanter. Now, maybe applying it on the trochanter would also be effective. Don't know, haven't tried it. I'm not treating this person, she's far away. So that is a consideration. That is something you can try. And the foam gives a little bit so it conforms to the shape of the body, so maybe it would be tolerated well. And it's unknown territory. Again, I have no case to cite with this experiment. This is theoretical only. And I would submit that laying on that for 5 to 15 minutes once or twice a day might be helpful. And of course you would also do it on the other side of the body. And this is a theoretical presentation, and it's for those that don't tolerate the pelvic binder. Of course, it would be wise for them to see a physical therapist and do core strengthening and especially Kegel exercises as well. Hope this is helpful to those rare persons that don't tolerate the pelvic belt. Thank you.